As people grow older, blood pressure becomes more important to monitor because aging changes the heart and blood vessels in quiet ways. Many seniors feel healthy every day, yet high blood pressure can develop silently without pain, warning signs, or obvious physical symptoms. If blood pressure stays high for a long time, it can slowly increase the risk of stroke, heart disease, kidney problems, and memory decline. This video is created to help seniors and families understand why checking blood pressure regularly is a simple but powerful health habit. The goal is not to scare anyone, but to share clear and honest information that helps older adults make better daily health choices. If readings are very high, or if dizziness, chest pain, or weakness appears, a doctor should be contacted without delay. With the right knowledge and routine, seniors and their loved ones can work together to protect heart and brain health. As the body ages, blood vessels slowly lose flexibility, making it harder for blood to flow smoothly and increasing pressure on artery walls. This natural aging process means the heart must work harder to pump blood, even during simple daily activities like walking or climbing stairs. High blood pressure places constant stress on the heart and brain, raising the risk of stroke and heart failure over time. Many seniors do not feel any discomfort when their blood pressure rises, which makes regular checking extremely important. Without monitoring, dangerous changes may go unnoticed for months or even years, allowing silent damage to continue. Regular blood pressure checks help doctors adjust treatment early and prevent serious complications later. When numbers are tracked over time, seniors can better understand their health patterns and respond wisely. If readings stay high or change suddenly, medical advice should be sought without waiting. Blood pressure readings include two numbers, with the top number showing heart pressure and the bottom number showing resting pressure. For most adults, a healthy reading is usually below 120/80, which means blood flows easily through the arteries. Readings between 120 and 129 may suggest rising pressure and should be watched carefully over time. When numbers reach 130/80 or higher, this is considered high blood pressure and needs medical attention. Some seniors may have slightly different targets depending on health conditions, medications, or past medical history. Sudden changes, even within normal ranges, should not be ignored and deserve discussion with a healthcare provider. Keeping a written record helps doctors see long-term trends instead of judging health from one single reading. If readings are consistently high or confusing, seniors should ask their doctor for clear guidance. Healthy seniors without a history of high blood pressure usually benefit from checking their readings 1 or 2 times each week. This routine helps detect slow changes early, before serious health problems have time to develop. Seniors who have been diagnosed with high blood pressure should measure their levels every day, preferably in the morning and evening. Daily monitoring helps show how lifestyle habits and medications affect blood pressure throughout the day. Those who take blood pressure medicine should measure before and after taking their medication when advised by a doctor. This practice helps doctors see whether treatment is working safely and effectively. Seniors with diabetes, heart disease, or kidney problems may need more frequent checks under medical guidance. If measurements become unstable or unusually high, medical advice should be sought promptly. The best time to check blood pressure is usually in the morning, after waking up and before eating or taking medication. Morning readings show how the body behaves after rest and help detect early signs of rising pressure. Measuring again in the evening, before bedtime, helps compare daily changes and spot unusual patterns. Evening readings reflect how daily activities, stress, and meals affect blood pressure levels. Seniors should avoid measuring right after exercise, bathing, smoking, or emotional stress. These activities can temporarily raise numbers and give misleading results. It is helpful to measure at the same times each day to build a reliable long-term record. If morning and evening numbers differ greatly, a doctor should be consulted for advice. Before measuring, seniors should sit quietly for at least 5 minutes to allow the heart and body to relax. The back should be straight, feet flat on the floor, and legs uncrossed for accurate results. The measuring arm must rest at heart level on a table or armrest to avoid false readings. Talking, watching television, or moving during measurement can affect accuracy and should be avoided. It is best to take 2 readings 1 minute apart and record the average number. Writing down results helps track long-term changes and share clear information with doctors. Using the correct cuff size is important, as cuffs that are too small or large may give wrong values. If home readings are confusing or inconsistent, professional medical advice should be requested. Blood pressure readings above 180/120 are considered dangerous and require immediate medical attention. Seniors who feel severe headache, dizziness, chest pain, or shortness of breath should not ignore these symptoms. Sudden weakness in the face, arm, or leg may be a sign of stroke and needs emergency care. Blurred vision, confusion, or trouble speaking can also indicate a serious blood pressure-related problem. Large and unexpected changes in daily readings should be discussed with a doctor as soon as possible. Feeling faint or collapsing after measuring may suggest unstable blood pressure and needs evaluation. Delaying medical help can increase the risk of permanent damage to the heart, brain, or kidneys. When in doubt, it is always safer to contact a healthcare professional for guidance. Eating less salt and choosing fresh foods helps reduce strain on blood vessels and supports healthier blood pressure levels. Walking for 30 minutes a day improves circulation and helps the heart work more efficiently. Taking prescribed medicine at the same time each day is important for keeping blood pressure stable. Getting enough sleep allows the body to repair itself and regulate blood pressure naturally. Managing stress through breathing, music, or gentle hobbies can prevent sudden pressure spikes. Avoiding smoking and limiting alcohol protects arteries and reduces long-term health risks. Drinking enough water helps maintain proper blood volume and supports circulation. Regular blood pressure checks help seniors understand their health and detect problems before they become serious. Knowing personal numbers allows older adults to take responsibility for daily habits and medical care. Simple routines, when practiced consistently, can protect the heart, brain, and kidneys over time. Family members play an important role by reminding, supporting, and encouraging healthy monitoring habits. Sharing records with doctors helps create safer and more effective long-term treatment plans. Small actions taken today can reduce the risk of serious illness in the future. Seniors should never feel embarrassed to ask questions or request medical guidance. Staying informed and proactive is one of the best ways to enjoy an active and independent life. If lifestyle changes do not improve readings, medical advice should always be followed. Regular blood pressure checks help seniors understand their health and detect problems before they become serious. Knowing personal numbers allows older adults to take responsibility for daily habits and medical care. Simple routines, when practiced consistently, can protect the heart, brain, and kidneys over time. Family members play an important role by reminding, supporting, and encouraging healthy monitoring habits. Sharing records with doctors helps create safer and more effective long-term treatment plans. Small actions taken today can reduce the risk of serious illness in the future. Seniors should never feel embarrassed to ask questions or request medical guidance. Staying informed and proactive is one of the best ways to enjoy an active and independent life.